Sometimes a patient in the ER looks like a psychiatric emergency, but the real culprit is leucine building up in the blood. Maple syrup urine disease, or MSUD, is a genetic metabolic disorder. Simply put, the body's ability to break down certain proteins malfunctions, and leucine keeps rising in the bloodstream. When infection, fever, surgery, or major stress hits, it can trigger psychiatric alarms. People may have hallucinations, become intensely agitated, grow confused, and, if it's severe, develop brain swelling. In this video, we'll walk through 2 real cases and 5 key mechanisms that explain what's happening. How leucine scrambles the brain's chemical signals, drains its energy, and throws off fluid balance in the brain. And why, if we lower leucine quickly enough, many psychiatric symptoms can dramatically reverse. If you're a family member or a healthcare professional, this knowledge could genuinely save a life. 1. Maple syrup urine disease, MSUD. MSUD, also called maple syrup urine disease, is an inherited inborn error of metabolism. In simple terms, the enzyme system that breaks down branched-chain amino acids, the bcaa complex, doesn't work well, so valine, isoleucine, and especially leucine build up in the body. It's autosomal recessive. Usually, each parent carries one silent variant. Leucine is the most harmful to the brain. Too much drains cellular energy, triggers brain swelling, and reduces key neurotransmitters, leading to a type of genetic metabolic brain disease, GMBDS. MSUD comes in subtypes. The classic form usually shows up at 3 to 5 days old. Poor feeding, sleepiness, increased muscle tone, vomiting, and urine that smells like maple syrup. Without prompt treatment, it can progress within about a week to cerebral edema and even respiratory failure. There are also intermediate, intermittent, and thiamine, vitamin B1, responsive forms. Because these retain some residual enzyme activity, patients may be relatively stable day to day. But infection, fever, surgery, or significant stress can precipitate metabolic decompensation with sudden psychiatric symptoms or ataxia. Some patients receive a liver transplant, which can greatly lower the risk of acute metabolic crises. Still, pre-existing neurological injury may not fully reverse, so ongoing management and follow-up are essential. 2. Long-term neuropsychiatric sequelae. Branched-chain amino acids are both fuel and regulators for the brain. Even mildly elevated leucine over time can erode cognition and mood. So even with early diagnosis and strict diet, many people with MSUD face long-term neuropsychiatric issues. Follow-up into adulthood, up to age 36, shows about 83% experience depression, anxiety, or ADHD at some point. If neonatal encephalopathy occurred, later risk rises, approximately 5 times for anxiety and approximately 10 times for depression. ADHD is common. Lifetime risk is over half in diet-treated patients, and in some series it's even higher after liver transplant. Cognition takes a hit. One study found average IQ approximately 81 in MSUD versus approximately 106 in healthy controls. Higher long-term mean leucine and a more imbalanced leucine-valine ratio track with worse cognitive performance. Motor symptoms are frequent too. In a follow-up of 17 adults, approximately 70% had tremor or abnormal tone, and about 1/4 had seizures. Bottom line, even with early treatment by adolescence and adulthood, you may still see depression, anxiety, psychosis, like features, ADHD, and movement disorders. largely because chronic metabolic instability keeps brain energy and neurotransmission off balance. Even when a liver transplant normalizes blood amino acids, some brain changes may not fully reverse. Two big challenges. Some infants suffer acute metabolic encephalopathy before treatment, leaving a fragile baseline. Catch the early window. Lifelong low-protein diet and prescribed medical formula are hard to maintain. When adherence slips, metabolism can decompensate fast. 3. Acute metabolic imbalance presenting as psychiatric symptoms in people with chronically high leucine. Infection, surgery, or major stress can trigger hallucinations, psychosis-like behavior, and even sudden death. Correcting the metabolic derangement in time can reverse symptoms. Case 1. 29-year-old man with MSUD. Many psychiatric emergencies are actually leucine spikes in disguise. This patient had MSUD since childhood, plus ADHD and depression as an adult, but he functioned independently. During an acute episode at home, he was folding towels and suddenly saw snakes. The hallucinations terrified him. In the emergency room, he became agitated and aggressive. He was treated as a primary psychiatric case, but sedatives didn't help. Reevaluation showed his blood leucine was about 10 times the normal level. Excess leucine is directly neurotoxic, causing confusion, loss of control, and in severe cases, cerebral edema. Once MSUD was recognized as the driver, the team started a specialized medical formula, bcaa-free, and IV, dextrose, to support metabolism. Leucine fell quickly, his hallucinations and agitation resolved. He returned to baseline and was discharged. Takeaway. In MSUD, psychiatric symptoms during an acute flare may not be primary psychiatry at all. Think metabolic crisis first. Lower leucine promptly and many symptoms can reverse. For patients and families, if hallucinations, extreme anxiety, or confusion appear, seek urgent care and state the MSUD diagnosis up front. Point the team toward metabolic crisis to save crucial time. Case 2. 25-year-old woman, disease course and challenges. Diagnosed on day 11 of life, she stayed stable on a low-protein diet and medical formula. She married, had a child, and seemed okay, though she struggled with anxiety and panic attacks. At age 24, after moving to North Carolina, things deteriorated quickly. Hallucinations and dissociative identity disorder, DID. Without a complete history at the ER, she was initially managed as a primary psychiatric case. A key clue emerged. Her leucine was extremely high, 2,549 micromolar. After starting a low BCAA medical formula and IV dextrose, leucine dropped to 614 micromolar, and her psychiatric symptoms eased. After discharge, she stopped the formula on her own, believing she was cured of MSUD. This refusal of treatment was tightly linked to her psychiatric state, highlighting the complexity of mental health in MSUD. Months later, she relapsed, hallucinations and DID again, this time with vomiting and seizures. Imaging suggested cerebral edema, and tragically, she passed away. Bottom line, in MSUD, psychiatric-looking presentations often signal a metabolic crisis. At the first sign of hallucinations, delusions, severe agitation, or DID, prioritize metabolic causes, check amino acids, and lower leucine fast. Carry an emergency care card, stick with prescribed medical formula, and keep up with follow-ups. These steps can change outcomes. 4. How MSUD drives neuropsych symptoms. Some psychiatric presentations are really the brain getting pulled under by leucine. First, a traffic jam at the blood-brain barrier. When blood leucine surges, it floods through LAT1 transporters, pushing out other essential amino acids, phenylalanine, tyrosine, tryptophan, and valine. Result? The brain runs short on the building blocks for dopamine, norepinephrine, and serotonin, making low mood, tension, and anxiety more likely. Over time, an imbalanced brain bcaa profile can even pull essential amino acids back out of the brain, disrupting development and myelination. Second, reverse transamination that bleeds key transmitters. Leucine's keto acid, α-ketoisocaproate, α-KIC, enters the brain and drives the bcaa transamination reaction in reverse. It strips nitrogen from glutamate and GABA to remake leucine, so brain glutamate, GABA, and glutamine all fall. Excitation inhibition balance shifts, and problems with mood, memory, attention, and motor control follow. Third, energy shortfalls and mitochondrial stress. Leucine and α-KIC inhibit crucial enzymes, pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase, stalling the TCA cycle and lowering ATP. Oxidative stress can hit mitochondria too. Starved of energy, neurons brown out, and imaging often shows reduced NAA. Fourth, osmotic imbalance, brain edema. Excess leucine disrupts cellular water electrolyte balance, swelling brain cells. In acute MSUD encephalopathy, you can see both vasogenic edema and intramyelinic edema, often called MSUD edema. As intracranial pressure rises, patients develop impaired consciousness, seizures, and abrupt behavioral change. Classic GMBDS features. Fifth, nutritional shortfalls that amplify risk. Long-term low-protein diets, if not well-designed, can leave gaps in zinc, selenium, and omega-3s, like DHA. These are core for neurodevelopment, neurotransmitter synthesis, and membrane stability. When they're low, cognition and mood suffer more. Modern MSUD medical formulas aim to cover essentials, amino acids, calories, DHA, and trace elements, to buffer long-term neuropsychiatric risk. Put it together. Even with good day-to-day control, MSUD can leave marks in deep gray nuclei, thalamus, basal ganglia, and white matter myelin. So attention issues, anxiety/depression, and motor unsteadiness are not unusual. 3 life-saving reminders. Carry an emergency card/ED protocol. At triage, say, I have MSUD. Please check plasma amino acids. Don't stop your medical formula. During infection, post-op, or any fasting, prioritize lowering leucine. Team up, Metabolic plus psychiatry. If hallucinations, agitation, or sudden sleep changes appear, put metabolic decompensation at the top of the differential. Early recognition, rapid intervention, and strong adherence are how we minimize long-term neuropsychiatric damage. If you want to learn more about inborn errors of metabolism, IEM, and their connection to mental health issues, specifically metabolic psychiatric disorders, be sure to subscribe to my channel.